Hi, we're here with Debi England of Summit Chiropractic and Sports Rehab, and she's going to tell us about her and her business. Thank you for joining us. So, Debi.
All right. Well, I have a chiropractic business that I have one day a week here in Prairie Grove. And I started chiropractic, my journey began when I was a teenager and was able to get chiropractic care and really helping me. And then nothing for years and years. I started working at a chiropractic office just out of coincidence and saw some really amazing things happen with patients. Folks that walked in or crawled in and walked out. People who said that they could do things that they hadn't done in years. And through a series of events, ended up not being there anymore. And someone said, "Hey, have you ever thought about being a chiropractor?" And I'm like, "Are you kidding? No." I'd been a nurse before, and so I had that experience. Right. And so I said, "You should look into it." I'm like, "Okay." All right, so 10 classes. In theory, that's all I should have had to take. Well, when it's been a while since you were in school, you have to kind of retake some things. Yeah. But I was determined that I wanted to do this. And my daughter was getting ready to graduate high school. And I thought, what am I going to do with the rest of my life? I'm not a mom anymore.
Not that ever to fill that time.
Exactly. So I decided to go to a professional school. So went to chiropractic school, graduated in 2012, and worked out of an office in Fayetteville for a while, just trying to build my practice and my patient base, and then found a wonderful little spot in Greenland, which is where my main office is. I had a lot of people coming from Prairie Grove to come see me, and I'm like, gosh, I need to look over this way. And I met Laura, and we just clicked, which was amazing, because when you have somebody that's kind of on the same wavelength about how you approach things, it's like refreshing that you're not having to fight all the time. It turned out to be...
Makes going to work fun.
Oh, it does. And I love hanging out with Laura, because she's first of all, she's very down to earth, but also she's a wealth of knowledge, and just really wants to see people get to the next phase of health. And that's why I think we work so well together. So we have a space here, and I come over once a week, and if I need to come over more often, I can, but we have a really great relationship as far as taking care of patients mutually, or I'll say, "You're a Laura patient," she'll say, "You're a Debi patient," and so that's a wonderful, because there's no competition. It's about who's the best fit, or do we need to marry that together. So anyway, so came over here to Prairie Grove and have been here, we realized, 4 years this week, and pretty amazing journey. We've seen a lot. We've seen tough times, we've seen great times, and I'm just excited for what we're going to bring together.
What is something that people may not know about you or your business?
The things where people come in, it's like, don't they have to come back forever once they start seeing you? No, but what the important part is to understand that people are functioning at a really low level of quality of life. A lot of people went home during the pandemic, so they're working in desks on their kitchen table, in bad chairs, in bad postures. And I think it really drove home that you're in pain, you don't even recognize it until you're like, oh my gosh, I can't move my neck because I've been sitting at the desk wrong. And so being able to, lost my train of thought there, but the idea is that we can do better.
Right.
When you get adjusted, all of a sudden you're like, oh my gosh, I can move my neck. And then you're like, oh, I feel like I'm starting to get tight again. And it makes you think, should I get adjusted again? So it's not me saying every single week for the rest of your life. It's you saying, I can do things better when I'm adjusted regularly. And like tis the season right now where everyone's getting out in the yards when it's not raining or snowing or sleeting. So there's
because it's only the middle of April.
I know, it's only the middle of April. But they're starting to do things in the yard.
Right.
And then all of a sudden they can't move well. And so saying, instead of me throwing a pill at it, let me see what else is going on.
Right.
And so then if I can help you do your job, your physical job, your fun part, all the things you want to do, why wouldn't you want to come see me regularly?
Right.
So it's not that you have to. You never have to see me again. But most people are like, I like it when I've been adjusted and I can move like I'm supposed to. So crazy, because we have all these little micro traumas that happen. It's not just, I fell off or something, or I had a car accident or something. It's I sit like this at my desk all day long. That's a micro trauma.
Oh yeah.
Going out and hauling 25-pound bags of potting soil, that's a micro trauma, because it's not something you do all the time. Yeah. And so all of those things add up, and then you're like, gosh, I can't move my shoulder, or every time I get up off this chair, I'm miserable. So why live like that?
Right.
Stay tuned up. Stay just like the Tin Man needed to be lubricated with a little oil every now and then. Same thing with your spine and your joints.
Yeah.
Because people have this, they have this newfound mobility, but then they're like, I think I can do more. And so that's where a relationship with somebody like Laura comes in, because she can do massage, but she can also do bone work. And so you look at those old traumas, it's like your body has to go back and heal every one of those.
Right.
And sometimes it's emotional healing, sometimes it's a physical healing, and that's what I really feel like I bring into your practice that a lot of docs don't, is that I look at you as a whole being.
Right.
What happened at the time that somebody had an injury, and are we still lingering with some grief or some emotions, some fears that are playing into it that keep you from moving? Because we're very good about, if it hurt once to go like this, you're not going to go that far. You'll go a little bit less because you don't want it to hurt.
Yeah.
And so unwrapping all of that, and the tissues keep all those memories, and so we need to clear those out. And I think people neglect that. I don't think that they pay enough attention, and they don't.
Oh no.
People don't always look at like their nutrition status either. They don't realize that the reason they hurt all the time, like you touch them or their low back hurts all the time, is because they're not having poops. They're eating foods that are super inflammatory to their body. They're not moving. There's a whole bunch of stuff that you have to look at what is happening to the person. And if you got somebody who's like in, out, and that's how they practice, they're never going to have a conversation and sit across the table and say, what'd you have for lunch today?
Yeah.
Was it good for you? How could we put more salad in your life? Or how can we work some anti-inflammatories? I want to be able to sit down and talk to people like that.
Yeah.
Because there's a whole lot more to it.
Yeah.
How do you balance it all out? And so that's another, you look at the whole picture is, can I talk to you about a B vitamin? Can I talk to you about magnesium? Can I talk to you about leafy green vegetables? Getting barefoot in the grass is amazing. Being out in nature is amazing. And those are things that help you build your own neurotransmitters so that your body can do a better job.
Right.
So it doesn't mean that those things are going to magically go away, but can I teach you some things that maybe no one else has talked to you about? I absolutely want to do that. And I feel like that's a niche that I have because I do care about the whole person.
Yeah, you're taking it from a holistic approach where everything plays a factor and not just, okay, well, I popped your back and you feel better for right now.
Exactly. And there's some people that want that.
Right.
And I'm totally like, in, out, we can do that. But if you're starting to tell me your story, because that's the relationship I want to have with people, is tell me your story, then we're going to delve into those other levels. And for some people, it's been absolutely life altering. For some people, it's like, I notice a little change, not huge, but my back feels better.
Right.
Great, that's where you want it. That's good. I just want to make sure that people live the best versions of themselves because they can move and do what they want to do.
Yeah, I think people are probably are coming to a chiropractor or a specialist type situation after they've exhausted so many other options, and so they're like, I've been dealing with this for years and nothing else has worked, so can you please just here's everything I've done and tried and this happened, please give me some relief. And so being able to offer them that holistic approach is great.
Yeah, and it's I always try to be very realistic. You didn't get this way overnight, so it's not like you pulled something and you heard a pop and boom, that's all that's happened. There's a lot of stuff that's added up to that. So just really trying to be realistic. It's probably not one and done. It's probably, we're gonna have to have a couple of adjustments to get you out of pain, and let's talk about what we can do for maintenance as far as what you can do at home, what you can do food wise, anti-inflammatories, and then getting adjusted regularly. Because every time a kid jumps on a trampoline, I'm like, go have fun, then come see me.
Yeah.
Okay. If you're gonna go, whitewater rafting, go have a blast, come see me, because things are gonna happen to your body. And that's all. It's just like you go to your dentist regularly, you go see your eye doctor regularly. So if people would just think about that, I'm part of your team. You don't need me all the time, but you need me sometimes. I do think it's important to say, okay, what am I doing with my time?
Right.
And what does it do for my brain? So if we're on our devices all the time, that's not good for us, no matter what, because you're really numbing your mind. And also the blue light that comes from your devices is so bad for your sleep.
Yeah.
And so people that go to sleep with their phones, it's like you're wrecking your sleep because you're telling your pineal gland, it's daytime, don't make melatonin. Okay? It's like, no, we need that to have good sleep cycles. I recommend a product called Illuminize that's good for helping the blue blocking. It helps protect the eyes. Because again, it looks the whole thing.
Right.
I can't get you off your computer because that's your job.
Right.
But how can I support you? Can I talk to you about the ergonomics of your desk? Can I talk about your chair? Can I talk about getting up every hour and making sure that you just take a lap around your house? Can I talk about how you support your eyes, because whether it's blue blocker glasses or Luminize? Can I talk about your water intake while you're sitting there at the desk? All of that plays into how often you come see me because you're like this.
Yeah.
Because I'm not here to tell you how to, that you have to do things a certain way. I'm going to say, here's some things I suggest, and you can take those suggestions or you don't. You'll come and see me more often when you don't, but that's okay, because I'm here and I'm not here to judge. So I just want you to live your best life.
Yeah.
I want to be a partner with someone and saying, I don't feel as good as I think I could. Let's talk about, what does that look like?
Yeah.
What are your goals? Because it's not just about me. It's like, what do you hope to gain from walking through my door?
Right.
And let's together work on that. And some people have like serious, they're like, you're right, and they're in here whenever I tell them to come in, and they're changed their eating habits and they're sleeping and they got a new pillow and they started the supplements, and I don't hardly see them anymore because they're feeling so amazing. Yeah. But other people, we do starts and stops, or they don't like any of my recommendations, so they don't come back. Then you're not for me, and I'm okay with that. I want someone to feel like we're good partners, that I'm not here wagging my finger at you, but I'm saying, how can we get you to where you want to be? Someone who's never been to the chiropractor before has a lot of assumptions about what the visit's going to be like. They think it might hurt, and then they think I'm going to give them some huge plan. You're going to give me $3,000 right up front, and we'll see you every week for 6 weeks or 6 months. And I'm like, that's not how we do this. We're going to sit here, we're going to talk about what are your goals, and factor in your schedule, because for a lot of people, schedules are challenging. People are running their kids 3 or 4 places a week and trying to find that little, here's my spot that I can get me taken care of. And so I'm always cognizant of how can I best serve them, but also tell them the truth. This is what you need. And so with an adjustment, I have a huge tool chest of ways that I can adjust somebody. It's not always a twist and crack. It's definitely not what you see usually on YouTube.
Oh yeah.
Oh my gosh, when I hear you do that towel thing, no. I don't know how anybody does that towel thing, because that's a liability right there. Yeah. But I adjust babies. I get babies right after they're born. That is the most amazing thing. I can adjust anybody along the spectrum of age, because I have something for everyone. I do have a primary method called Activator, which is really gentle, very specific, but I can also do a manual adjustment if that's what's needed. So I think people need to understand it's not just whatever you heard, the worst case scenario from somebody is not what happens here. And that we're going to talk through all of that. If you've had a bad chiropractic adjustment, I would love to talk with you, because I want to talk to you about how we're different.
Right.
And women chiropractors are definitely different, because guys want to muscle through it. If they can't get it to move, they're going to make it move. You don't have to do that. Physics is what is on our side. And so I can go, whoop, there it is, because I've waited for the moment and I feel it, versus saying I'm in a hurry and I need to get going. Right. It's nothing against guy adjusters, but women are just different. We view things differently.
But you've been in Prairie for 4 years. So have you seen any huge changes, or any changes that you think Prairie should have? Or I feel the same way. I feel like since I've lived in Fayetteville, and my grandparents are in Farmington, so I've been out to Prairie a ton, and it has expanded and gotten bigger, but I don't feel like it's really changed the feel of the town very much, which is really nice, because it does have that kind of older, small town feel to it.
Yeah.
But what have you noticed in the time you've been here?
I like that there's sort of the separation. That there's the highway, what's happening out on the highway, and then you take that ride into town. And there's a little shift, but it's not so big that all of a sudden Prairie Grove became something different.
Right.
And so I'm like, go ahead, develop out there on that highway, because it's just
does feel more like suburban and modern out there, but then as soon as you turn off at that light,
welcome to Mayberry.
Yeah.
And I appreciate that, because I do feel like there's a quaintness to downtown, and even at events like Junk Ranch and things that bring people into town, it still feels like a little town in New England where tourists come in, but they leave, and then you get back to regular life. The clothesline fair and the square dancing and the Friday night lights and all of those things, and that is what I think makes Prairie Grove really cool. Is that you can have the big things, but it isn't going to change you so much that it feels that way all the time. I just feel like it's got so much charm. And I love that I can walk down the street and meet people that I would meet at the gas station, and I can go shop at one of the stores. And
oh yeah, I mean, I know like everybody who works up and down this road knows each other.
Exactly, and it's a community. And I tell you that if something happened to one of those, the entire community would come around, and I think that that's a really valuable thing. And the fact is that chances are the person you work to next door, went to school with, their sibling or something like that. There's these, I guess, a web of connections that I think is really valuable that you can't always get in a big town.
What are your favorite things to do in the Prairie Grove, Farmington area, or favorite restaurants? Or
well, I just got back from Gabby's. That's where we ate lunch
really
today.
Good. Gabby's is really good. We eat there very often.
Yeah, so that's one of my favorite places. And then, of course, because the office is right across from Magnolia, I have like 10 punch cards that are partially full between, going and grabbing lunch or a sweet little pastry that I can take home or a coffee or something. I love that place, and I love the kind of culture that they've created around it. I'll go sit on the patio when it's nice and sunny and eat my lunch or just soak up the sunshine. So that's probably my favorite place is Magnolia, because I can get everything I need there.
That's like, what do you like to do when you're not here?
Take road trips, stuff like that. I'm very family centric, so that's chances are I'm doing something with my family, and I think that's why I treat the practice like I do, because that's very valuable to me, like a mother hen. So not a big outdoorsy person, but I love to go sit on a porch where there's a lake close by or something like that. But if I'm looking for things to do, it's like, what's happening in Prairie Grove? Is there a pancake breakfast? Is there a festival? Is the farmer's market starting? So I do like to come out to things like that as well. I think it's good to get out, and then you get to see your neighbors, because I think we've forgotten who our neighbors are sometimes. Right. And so being able to say, hey, look at how you've grown, oh my goodness.
Especially in a small town like this, you actually can keep up with people that you know. You're not just in a crowd of strangers. Yeah. There's a chance that you at least partially know somebody else in that crowd.
Right, or they'll kind of recognize, don't I know you?
Do you have any exciting plans or anything for your business here?
I think to ramp up the side of the holistic, there's a lot of things that I can do that are not related to your spine.
Right.
I can sit down and talk to you about a nutrition plan. We can plan supplements out. We can, there are things that I can do to help you go that step beyond. And so I'll be developing more of that. Okay. I really want people to understand their genetics. Because just like your medication, sometimes they choose the wrong one. When you get all those pieces put together, you recognize, it's like, holy cow, I feel amazing. Right. Everything's clicking on all cylinders. I'm sleeping really good. I'm eliminating really good. I have good energy. But a lot of times no one sits back and says, wait a minute, we need to look at this a little differently. One of the things that just came out with genetics, people don't really think about it, but there's a simple one, MTHFR, which has to do with how you process B vitamins, and then COMT, which a lot of people have a coding error, so it manifests as ADHD. And so everyone wants to shove a medication at it, when what you need is a methylated B vitamin. We had all the vaccines just recently, and everyone's like, don't take the J&J, because it's the one shot, but it also can cause clots. Well, guess what they just figured out? That people who have a PF4 genetic coding issue are the ones who get the clotting. Oh. Well. So if we knew more about genetics, we might be able to head some of that stuff off. I have a simple questionnaire that I have my patients fill out and say, we need to look at this a little differently because of how you're uniquely made. So I want to do more of that so that people can understand how distinct they are, and it's not always a one size fits all. Maybe you can tolerate, dark leafy greens, but you can't. So let's talk about how can we get that in this person here. How can we get the benefits of that, not through food, but maybe through a supplement or through a juice or something like that. And I feel like that's something that no one's really talking about. Is like, how can we look at you as an individual? I just know there's a better way. Oh yeah. And I like I said, I want to be part of that solution so that people can feel like, yeah, I can manage this, and it's not hard. It's just a matter of somebody else guiding you through that. Right. Like I said, an adjustment is only part of the picture. If that's all somebody wants from me, that's okay. But if they want more, I'm happy to help them with more, help them navigate. Yeah. What's the best way for people to get in contact with you or get a booking or anything like that? So best way is to call me, 479-225-4972. and they can call or text. And texting is probably better. I'm more likely to answer quickly. And then I have a Facebook page, Summit Chiropractic and Sports Rehab. I didn't mention that part of my training, I have a master's in sports science and rehabilitation. And so when you get injured and things aren't working right, we can work on a plan to get you strong again. So those are the two best ways, calling me or sending me a message through Facebook. I don't take walk-ins. If you walked in, I can say, let's schedule an appointment, because my schedule is full enough that we just don't have that ability. And I want to be able to say, oh, I probably need to schedule a little more time with you. So be able to prepare for that. But yeah, just give me a call and be happy to see how I can help. And if I'm not a good fit, I don't think you're a chiropractic patient, I'm going to tell you. I'm not going to say, ooh, let me try 4, 5, 10 times, and oh yeah, you probably should go see somebody else. I'm not about that. I'm about, if I'm a good fit, I'm going to take care of you. And if I feel like after one visit you need to go see Laura, I'm sending you to Laura. If I'm like, we need to get an x-ray, I'm sending you to get an x-ray. So I think for a lot of people, I'm your fit. But for some people, I'm not. And I'm totally okay with that. I'll refer you where I think you need to go.
Right.
And we'll talk about that together.
Awesome. All right. Well, thank you for joining us while we learn more about Summit Chiropractic and Miss Debi. And if you have any questions about what she does or trying to get an appointment, like you said, call or text, or message her on Facebook. And then if you have any more questions about park bench or real estate issues in Prairie Grove, you can find all my links down in the description. And thank you very much for being with us today. Have a good one.